Welcome everyone to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
All right, welcome, bitches, to the Transformation Nurse Academy podcast. My name is Kevin. This is the episode for the CCVONS. This is the California Central Valley Oncology Nurses Symposium. Welcome, and we got a lot of guests that we are interviewing here at this symposium, and we appreciate you attending. We hope you like it. So let's get to our guests, and I hope you have a great day. Hope you like this podcast. I love you, bitches. I love you. Let's get going. How you doing, everybody? My name's Kevin. I'm with the Transformation Nurse Academy podcast. I have the great pleasure to interview Dr. Hasib. He just got done talking at the Central California Oncology Nurses Symposium. So I know I already told you his name, but tell us your name, Doc, your title, and how many years experience do you have in oncology?
Yes, thank you so much for having me. And my name is Abdul Mustajib Hasib. I'm medical oncologist with C-Care. Been in Central Valley for about 24 years and oncology about 27 years. So we have grown quite a bit, and it's great to be taking care of patients in the Valley. Yes.
So what made you decide to support this educational symposium?
Yes. So I like what the oncology nursing are doing for patients and for the community. And this is really very dear to me to be able to help out in terms of educating not only our peers and nurses, but also the patients, especially, and how to interact and how to be best for them so that we can have the best for the patients, because the patients are the bread and butter for us, that we have taken the gauntlet to really help out the patients. That's exactly what our motto is and what mission is.
I like that. So what topics, what do you think about the California Central Valley Oncology local chapter?
Yeah, I think it is amazing how much they have done and provided for the community in terms of education, as well as helping the nurses, as well as providing so many options and things for the patients. So for patient care. So I think collaboration is the key, and that's what they're trying to do, and helping the whole community and the patients. So in the Valley. And so that's excellent.
Yeah. And then, so what topics would be of interest to you next year at the next symposium?
Sure.
What should we talk about next year?
So I think I would like to see more, patient-related topics. What we can do to help them. I think that would be more important in terms of, their safety, their, surveillance, and so kind of those are more important, because otherwise, day-to-day things we deal with them anyway. But I think those will be important. What can we do to make the life of patients better? Care, we provide. I think we do excellent care. The service, what kind of service we're providing to the patients, when they, connect with us. How can we improve things for their connectivity, to have a liaison between them and the providers? I think those kind of topics are important. How we can make better, effective communication between the patient and the provider. So those kind of topics would be very important.
Can I sneak in a commercial for the oncology group?
Sure.
This year they're going to have an angel project where they're trying to get us to donate money, minimum $15. The money we get, all proceeds are going to go to 3 patient families so they can have a better Christmas.
Awesome.
So what do you want to tell nurses and everybody to do?
Everybody to donate whatever they can. Right. Yes.
All right, so what is your message for the Oncology Nursing Society in general?
Yes, so in general, I think keep up the good work. This is wonderful. This is something that I would never do anything else. This is very dear to me, to be able to, take the patients along in their journey. It is so much that they go through, but it is, up to us how we can help them, how we can take them along. So I think the whole society needs to provide tools for that, for education, for the peers, for the patients. So I think they're doing a great job, and continue doing that.
Thank you, Doc. I appreciate you taking the time, and thank you for speaking today. And don't forget, we're going to see a picture of all the bow ties. You like bow ties, huh?
Absolutely, yeah. That's
Thanks,
for the
Doc.
patients.
Yeah.
All
Okay.
right.
Thanks, Doc. You have a
Thank you.
great day.
All right.
Thank you.
Take care.
All right. Thank you, Dr. Hasib. I appreciate you coming on and letting us interview you. It was awesome. Thank you, and I appreciate all you do. All right. Our next guest is Brittany Dadino. She's a nurse practitioner, surgical oncology, Central Valley Breast Care. Can you tell us your name and title?
Yes, so Brittany Didino, oncology nurse practitioner.
So, Brittany, thank you for coming. And then, so can you tell us what is your interest in the oncology symposium?
Yeah, so today I'll be speaking. I'll be speaking about survivorship care. What is it, and what is entailed in a survivorship clinic? And when patients come in, what does a visit look like?
There's such a thing as survivorship clinic.
There is, yes.
Now you got my interest. All right. So, how long you been in oncology, or how long you been in nursing, or both?
I've always ever been in oncology, and that started in 2013 as inpatient oncology nursing.
All right. And so, what do you think about the oncology symposium put together by the nurses here today?
Yeah, I think it's great. I think they have got some really interesting topics, and they're bringing a lot of education to the oncology nursing group here in the Central Valley.
I think hers is probably the most interesting. All right. So, what message would you like to give to the nursing community about oncology or just nursing in general?
Yeah, so kind of like today that I'll be talking about, a lot of people don't understand what survivorship is, what it means, and what is a survivorship clinic. So I'm eager to educate the nurses today on what that is and how they can be involved in it.
Right. I've been doing this 30 years and I have no idea what that means, but I'm going to learn it, and I'll come back and report. Thank you, Brittany. I appreciate you taking the time, and I'm looking forward to your session.
Thank you.
Thank you. All right. Thank you, Brittany. Ms. Dadino, I appreciate you. Thank you for the interview. Hope you have a great day. Thank you very much. Our next guest is Preet Karaldi. She is a physical therapist, DPT, CLT. I don't know, man. She got a lot of damn acronyms here. She's an oncology rehab specialist at Kaiser Permanente. Thank you, Preet, for joining us.
I'm Maripet Corralde. I'm a physical therapist. I'm also an oncology rehab specialist and certified lymphedema therapist.
What does that mean, lymphedema specialist?
So you get special training so you can treat lymphedema patients.
What do you do to treat them?
There's a lot of things that you can do. A lot of education on lymphedema precaution, compression therapy, manual lymphatic drainage, exercise, skincare, education.
So, Kim, I get a link from you so I can post it with your interview so people can learn more about what you do?
Okay.
Yeah. Because I work in the ER, so we don't.
Oh,
really,
I see. Okay.
We don't really do.
I work for Kaiser though, so we're
you shouldn't have said that, because Kaiser and work don't go together.
You should.
I like this. It's nice.
Yeah.
All right. So, what is your interest in this oncology symposium?
I'm actually one of the speakers. I'm going to talk about cancer rehab, breast cancer in particular.
All right, perfect. And then, are you in oncology? So you specialize in oncology?
Yes, I've transitioned from mixed practice to the clinic, just working with oncology and lymphedema patients.
And then, so what do you think about the oncology symposium put together by the nurses, and what do you think about the board?
I think it's a great networking opportunity, and also a great source of information for a lot of the nurses and other clinicians.
Nice. And then, what is your message to the nursing community regarding this event?
I just wanted to raise awareness about what rehab is and what we can do as an adjunct treatment for their patients to help them with the impairments from cancer treatment as well.
And is your treatment inpatient or outpatient or both?
Outpatient.
Oh, all right. Thank you, Maripet. I really appreciate you joining us. Thank you very much.
Thank you.
Thank
Bye-bye.
you. All right, Maripet, thank you for the interview. We appreciate you. Thank you very much. We hope you have a great day. All right, my next guest is Dr. Regina Lako. She's from UCSF Fresno. She's the Assistant Program Director, HPM Fellowship. She's the Assistant Clinical Professor of our Hospice Plus, Palliative Medicine, and Community Cancer Care Center. Welcome, Dr. Regina Lako. How are you? And she's a Mercy physician as well.
I'm Gina Lako. I'm a physician. I am trained in emergency medicine, but right now I primarily do palliative care, inpatient and outpatient, and I still do a few ED shifts a month also.
So we talked about this before we started recording. Why should emergency nurses care about oncology patients?
And I learned this firsthand in the working in the emergency department, is that, we see these cancer patients come in, sometimes for maybe not quite as sick, but something is going on. But it often can be, an acute change, acute decline, decompensation, and often, unfortunately, patients and families aren't ready for that. And that's where, my palliative care interest comes in. But definitely, experience that in the emergency department is that we're, playing that role there too.
Should nurses, I know this is off topic, but should nurses in the ED try to learn about palliative care? And maybe should we have a palliative care nurse in the ED?
I think that would be amazing. I think, yes, definitely, because it's not just cancer patients. It's all, advanced stage illnesses or acute illnesses. Yeah, we have a lot of our patients that we get consulted for palliative care, end stage liver disease, heart failure, renal failure, and, definitely other things, strokes, advanced dementia, trauma.
Do you work with the chaplain? Do you work directly with the chaplain?
I do, yeah.
With Kevin?
I do.
Do you really?
Yeah,
Oh,
yeah. I worked with him inpatient at Clovis, and now he's full time at the cancer center where our palliative clinic is. I still work with him.
I like Kevin.
Yes, he is great. He is great. He's invaluable.
All right. So, what was your interest in this? I don't know if I asked it. I already asked it. Are you in oncology healthcare, which we already know? But what do you think about the oncology symposium that the nurses put together, like Nellie and all the active board members? What do you think about that?
I think it's great. They had such a variety of speakers and topics, but all to really further education, understanding of what options there are for patients, what are new things coming up for patients that they may see, and so they know how to have conversations with the patients or with the providers. So I think it was a great day.
So what kind of topics that would be interest to you? Like what kind of topics in oncology would you like to see us cover next year?
I think you mentioned a good one is, how oncology patients, maybe issues that come up for them in the emergency department and how they're best addressed or supported in that setting.
Okay. And then what is your message to the nursing community, specifically the oncology nurses, but even ER nurses? What is your message to us regarding this event and events in the future?
I would say it seems like a great chapter to be a part of, to join, to be aware of, events and education that is ongoing. And, they were telling me that really the focus is local, which I think is great because we do have, we have multiple cancer centers here. We have a lot of great local resources. So just getting to know each other and what our resources are in the Central Valley. So I think it's a great place for connections as well.
Did Nellie and the team tell you that they have a Christmas Angel project this year?
They did not.
So what they're doing is I'm not asking you, but maybe you can tell everybody.
Sure.
Since, you got good influence. They're asking to donate minimum $15 to whatever you want to. They're going to take all the proceeds and donate to 3 local families to help make their Christmas better.
Okay.
So what would you like to tell all of our healthcare colleagues?
I think that sounds like a great cause to support, and hopefully that is, I assume, on the website, maybe,
I'll put
or
the link on it.
Okay,
I'll attach it to everybody's interview and stuff.
Yeah, because there's a lot of need, and definitely the stress of illness brings up a lot of other things that we're just not prepared for. So I think those things are very they're very grateful to have for them. So I'm glad that they're doing it. Yeah.
All right, Doc. Thank you for the interview. Thank you for speaking with us.
Thanks for having me. Yeah,
and
of course.
One last message. What would you like to tell all the ER nurses about ER and oncology? All right, you guys. Go ahead.
Okay. Just that they're, I do both. So I'm more palliative, but see a lot of oncology patients and emergency medicine, and both vital to I think work together. I think we can really help each other and our patients by understanding what goes on in our different realms. Yeah.
Thanks, Doctor. I appreciate you.
Sure.
I appreciate you. Have a good day.
Thank you too.
All right.
Okay.
All right. Thank you, Dr. Lako. It was a pleasure meeting you. You have a great day, and go ER nurses, even though you're in palliative care. Thanks, Dr. Lako. My next guest is my favorite. His name is Chaplain Kevin Rami. He's the Oncology Support Services psychotherapist and at the Community Cancer Center. So welcome, Chaplain Kevin and Chaplain Rami. I appreciate you. There's not enough Kevins out in the world, so make sure you spread love and joy. How you doing, sir?
Doing good, thank you.
So I know I've already told your name, but just again, if you can, repeat your name and title, and then what is your interest in the Oncology Symposium?
Yes, so my name is Kevin Ramey, and I've been working at the Community Cancer Institute now for 4 years, and I provide psychotherapy to patients who are in emotional distress.
So even though, let me ask you this, not on here, but I was saying, what type of faith as a chaplain do you subscribe to? One particular faith, or do you have many different faiths? Because I know you have to minister to different patients.
Yes. So I'm a Christian, born again Christian, and but as a trained chaplain, we minister to all faiths and individuals who have no faith. And so we're able, because most of what we do is non-religious.
Right.
And we help individuals in crisis to help them understand what they're going through and how to come to terms with that.
Right.
Come to the place of peace and acceptance.
Right. So were you ever in the military?
Actually, I was.
That's how I got a dirty mouth. I spent 12 years in the Army.
I did 6 years in Army Reserve.
Oh, right.
Yeah, and then from there I went into
Army Reserve, not Air Force.
And then I went into healthcare chaplaincy.
So that's how you became. But do we have chaplains in the civilian world? Like, I know you're a chaplain, but do we? If they weren't in the military, do they have a chaplain service in the civilian world?
Yes,
like they do in the military.
Yes. So we have university chaplains. We have even veterinarian chaplains.
Oh, really?
Yeah. In addition to healthcare chaplains, there's obviously hospice chaplains, prison chaplains. So the chaplains are across the board.
It makes sense to me, but I just never heard of veterinarian. Like, you really pray with people, with their animals?
Yeah, but remember, most of what we do is non-religious.
So you support them emotionally.
Yeah, you support them emotionally. Yeah.
My wife would love you.
Yeah. Even in the sports arena, a lot of franchise sports teams have chaplains on their team.
Is it because you said you have a background in, you said psychology?
Well, somewhat psychology, but again, because of most of what we do is non-religious, and it's to people who have faith or no faith, we're able to help individuals come to terms with what they're dealing with, what stress they're encountering, so that they can function well in their careers or getting through their treatments.
So if I got hurt in the job as a sports football player, you would help me understand that.
Yeah,
that's the end of my career. It is what it is.
Yeah, if it's the end or if it's a temporary lapse, and yeah, because it's all about morale, keeping individuals' morale, keeping individuals at the top of their game. So to speak.
We don't have chaplains for nurses to keep us at the top of our game.
Well, we do, because what we do, our work is not just for patients; it's also for staff members.
But nobody's ever told us that we can come to you and.
Yeah.
You know, when people hear chaplain, they automatically think what?
Religious, right. End of life, those type of things. But at community, pretty much I would think in general, our staff, whether it's nurses or doctors, they know they can come to us.
I've been a nurse 30 years and I didn't know that.
Yeah. So
so you specialize as a chaplain in oncology, or do you cover everything, or is that your specialty?
My specialty right now is cancer patients, because I work at Community Cancer Institute, and I see individuals who have elevated anxiety, depression, stress, and I provide psychotherapy to help relieve them from that.
So what did you think about the Oncology Symposium put together by the nurses like you who are active board members and actively participate in creating these events?
This event is incredible. Not only is it a good support system for our nurses and what they do, but it helps us to understand the broader work of oncology in different settings, not just in the hospital setting.
Right.
And I'm here at community, but there's individuals from CCare, there's individuals from Kaiser, and we're able to share what we do and compare and learn from each other.
Because I work in the emergency room, and a lot of people ask me, why does an emergency nurse come to oncology? But we get oncology patients everywhere. So.
Exactly.
So what is your message that you would like to give to the nursing community regarding this event and events like this?
I would say you're doing an incredible job. Keep on doing what you're doing. It takes a lot to do what you do. Take care of yourselves, take care of your families, and take time just to breathe. Take time to exhale, because we want you to do what you're doing for the long term, because patients are counting on you, and my heart goes out to you, and I'm just blessed just to be able to share in what you're doing today.
Thank you. Thank you. And remind everybody again, what's your name?
My name, Kevin Ramey.
And what does it mean? What does Kevin mean?
Kevin means one of the best names on the planet.
Yes.
It means kind and gentle.
Don't forget that, kind and gentle.
Hey, we got you, dude.
All right. Thank you, Chaplain Kevin Ramey, for joining us. We appreciate you. We love you. We hope you have a great day, and go spread love in the world from all the Kevins. All right. Thank you, everybody, for joining the Transformation Nurse Academy podcast. I hope you had a great time here at the California Central Valley Oncology Symposium. Thank you for listening to our interviews with all of our special guests. And we look forward to seeing you next time. All right, bitches. Peace. I love you.
Don't miss out. Engage with us weekly. Share your thoughts, and let's transform the nursing landscape together.